The 24th annual Lustgarten Foundation Long Island Walk for Pancreatic Research kicks off this Sunday. The fundraising event brings thousands of people together who've been impacted by pancreatic cancer and helps raise funds and awareness on the disease. Joining us now to discuss is Janice Canfield, pancreatic cancer survivor, and Dr. William Nealon, surgical oncologist at Northwell Health Cancer Institute. Welcome.
Welcome. Thank you.
Welcome. Thank you. Thank you. But great to be here.
Dr. Nealon, what are some early signs of pancreatic cancer people should know about?
Well, I think in general, there's one that sometimes gets ignored, which is just unexplained weight loss. If you find that you have lost weight and you weren't trying to lose weight, that too often is much more meaningful than you think. There are other things, like one of the signs can be jaundice, which is a big word, but people's skin can turn a little bit yellow, their eyes can turn yellow, their urine can suddenly be darker, and that can be an early sign. One of the recently recognized early signs is a new onset of diabetes. So you may find that you've just been diagnosed with diabetes at the age of 55 or 60 or later, and that can be a meaningful finding. Diabetes is quite common in America, but that can still be a subtle finding. There's also something called pancreatitis, which is an inflammation. You go to the hospital because you have pain and you're sick. And unexplained pancreatitis over the age of 50 is also at least potentially a warning that there's a cancer in there.
And Janice, tell us about your journey and how you knew something was wrong.
Okay, so when I was in summer of 2022, September of 22, my father told me that I was looking a little yellow, and I didn't realize because summer tan and whatever. So I happened to have a doctor's appointment the next day with a dermatologist. And when I was there, I had asked him to tell me if my skin looked yellow, and he said it did. And I told him I already made an appointment with my primary, and he said, let's just get some blood work. So he did a hepatic panel, and then he called me in like 3 days and told me all my enzymes, my liver enzymes were elevated. And and then my primary called me and he said, get to the emergency room right now. And I'm a nurse, and I've been a nurse for over 30 years. So I just had it in my head that it was cancer. And I had to drive quickly over to North Shore, and I was diagnosed with pancreatic cancer. And it was terrible.
My goodness, so thank goodness you got it taken care of, and that somebody even recognized there was a symptom and you had a doctor's appointment right away. I mean, that is so key. Yes. Dr. Nealon, since there's no testing for pancreatic cancer, how can people protect themselves?
Well, I would guess what I can tell you about some risk factors, two well recognized risk factors are smoking and obesity. And so you can influence both of those by just not doing that or trying to get some weight loss. You're right. There are a few tumor markers that are the holy grail, and we all argue about them. And there is one that's somewhat helpful, but it's only helpful once you know you have the cancer. So you're right. There's no easy way to find out without some sort of higher level of suspicion. I will mention that if you have a family history of pancreatic cancer, particularly among close relatives, that would be a reason to find a pancreatic specialist immediately. And we have protocols now here at Northwell, and we have geneticists online, because we do now recognize some of the genetic things that predispose to cancer. If you happen to have those, then that would be a reason to jump to a specialist in pancreatic diseases. I will mention that not every hospital needs a specialist in pancreatic diseases. So I would just encourage the public to keep looking. If you haven't found one, that's what you really need, is someone who's going to be able to know which things are meaningful.
Janice, let's talk about the walk and why it's so important in fighting this cancer.
Yes, well, Lustgarten's been around since 1998, and they have improved patients' understanding of what's out there and what's available for people diagnosed with pancreatic cancer. They're coming up with new treatments, and their goal is to improve survival rates. And I mean, my hope one day is that they'll find some sort of preventive measure so that it could be caught earlier rather than later, when it's too late to have surgery and get cured.
Well, Janice, I'm so glad you're doing well. Janice Canfield, pancreatic cancer survivor, and Dr. William Nealon, surgical oncologist at Northwell Health Cancer Institute. Thank you both for being with us.
Thank you. It's been great.
The 24th Long Island Walk for Pancreatic Cancer Research. It kicks off this Sunday, 9:30 a.m. at Jones Beach State Park.